go. Our presentation is Talk to Me, Not About Me, Nursing Handover in the Hospital Setting by Kasadi, Fishburn, Lincy, Helbling, and Catherine Powell from Carroll College, Department of Nursing. Our PICO question is, in adult patients within a hospital setting, is patient satisfaction improved when nurse handover is given at the bedside compared to when nurse handover is given outside of the patient's room? The background. Nursing handover occurs when one nurse hands over the responsibility of care for a patient to another nurse, for example, at the end of a shift. On average, nursing handovers occur 3 times a day for each patient. Another article mentions that Bedside Report is a significant change to the current shift report practice and culture of most organizations, but it is associated with both improved patient safety and patient and nurse satisfaction. Another article illustrates that research has found that patients felt reassured when the nurse had an understanding of their care, and they felt insecure when the nurse did not understand their plan of care for the upcoming day. When the handover is practiced poorly, actions may result in missing pertinent patient information, including delays in treatment or diagnosis for the patient, inappropriate treatment, or failure to provide appropriate treatment in a timely manner.
The first article was a level 6 research evidence study, and it was a qualitative one that focused on convenient sampling of semi-structured interviews, as well as observation regarding effectiveness of communication between patients and healthcare staff, benefits of nurse handover, rating of care, and views from nurses and patients regarding their role in care. The results suggested that bedside handover is beneficial as it decreases medication errors, ensures that accurate evaluation of patient care is performed, and provides an up-to-date overview of the patient's care. The second article was a level 6 evidence study, and it was a qualitative and observational one that focused on conducting observational interviews with patients and staff to assess safety and satisfaction of patients. This study suggests that bedside handover helps to create accurate and time-efficient communication and allows patients to participate in their care. For data collection, patient satisfaction was evaluated 4 months before and 4 months after this study using the Press-Ganey and the HCAHPS. The results suggested that nursing handover at the bedside allowed for an increase in satisfaction, safety, and patient-centered care. The third article was a level 5 evidence research study, and it was a discrete choice experiment that focused on collecting data through a DCE, which is a technique for eliciting preferences that can be used in the absence of revealed preference data. The participants were administered a survey on an iPad and asked to rank preferences on characteristics of nursing handover at the bedside. Results from the survey illustrated that both patient and nurse participants preferred handover at the bedside. Concerning the PICO question, the results expressed that handover at the bedside allowed patients to actively engage in two-way information exchanges. The next article was a level 4 evidence conducted in Australia, and they used a discrete choice experiment survey to assess the specific barriers to bedside handover. The results showed that nurses were initially reluctant to provide bedside handover due to time constraint. The next article focused on utilizing a DCE survey to measure preferences of attributes regarding bedside handover. 200 nurses were given a survey to explore and understand the barriers that nurses view during bedside handover. While this study doesn't directly measure patient satisfaction, instead the article focuses on communication between patient and nurse interactions. The study suggests targeting nurses to improve their value for bedside handover and patient-centered care, which includes many approaches like addressing misconceptions related to time constraints. This was a cross-sectional study and a level 4 evidence. The last article focused on utilizing a DCE survey in Sweden to distinguish the differences in preference during bedside handover between patients and nurses. A total of 218 patients and 101 nurses completed this survey. The participants of the study were asked questions on what they believed were the most important characteristics of handover. The characteristics included an invitation to participate, the number of nurses present at the bedside handover, family members, the level of patient involvement, and information discussed related to the care of the patient. The results showed that patients classified hearing what was said and the ability to speak their mind as the most important aspect, and nurses classified the patient's desire to participate in care as the most important in bedside handover. This was a quantitative study and a level 5 evidence. And we concluded that 5 out of the 6 articles supported our PICO question.
The results from the article suggested that bedside handover did increase patient satisfaction, as patients reported an increase in participation, the ability to ask questions, bring up concerns, and gain a better understanding of their care, diagnosis, and recovery within the hospital setting. Results also illustrated that with bedside handover, there was a decrease in adverse effects experienced by the patients, medication errors decreased, and there were fewer falls. These characteristics suggested that patient satisfaction was achieved with handover at the bedside. In regards to application in the nursing field, nurses could use this information to increase patient satisfaction and reduce complications in care. This practice could be taught to the charge nurse of a floor, and then over time be implemented and taught on different units. Nurses could also lobby at the Capitol to have nursing handover at the bedside and have it implemented at hospitals all across the country to increase safe patient practices and patient-centered care.